Hi folks, Dr. K here talking about the 6 principles of naturopathic medicine. The first principle states, first, do no harm. So this is something that almost every medicine tries to incorporate. We always want to be using the least invasive and least toxic therapies that we can and using the lowest effective dose. This is kind of the standard thing that we talk about in first, do no harm, but I think there's so many different ways that I incorporate this into my practice. So first, doing no harm for me starts from the very first time that you meet somebody. Unfortunately, lots of people have had negative experiences in the medical system and many different life events that can impact their comfort being in a medical office, talking about different topics, or having physical exams done. So first, do no harm to me really includes knowing and using people's preferred names and their preferred pronouns, thoroughly explaining any kind of physical exams and asking for consent before performing them. I have some patients that are so sensitive to pain that even like the simplest touch can be painful for them. So in that context, if I do my standard physical exam, I will be putting harm onto them. So first, doing no harm means talking to all of my patients about where and what is comfortable them and how is the best way for them to be touched if we need to do any kind of physical exam. And also creating an office space that is calming and comfortable to people. Creating a space where you feel comfortable to share all of the different things that we need to talk about in order to dig into your health is super important. This is why I offer longer appointments, an hour-long intake as kind of our standard naturopathic intake. Often towards the end of our hour-long intake, people will tell me something that they didn't want to share at the beginning because we've had that time to create a bond, to listen to each other, to understand and get to know each other a little bit better. And that helps to build trust, which is super important. I work with a lot of mental health patients, and though I'm not a counselor, we often talk about a lot of sensitive topics and traumas. And so creating a trauma-informed environment that is non-judgmental and compassionate for every person's life experiences, no matter what, is super important to me. And so that is what first do no harm means to me.